Things that are important for patients to come to triage for: pain, leakage of fluid, vaginal bleeding. But the number one, I think more than anything, is nausea and vomiting. Hello, everyone. So as I sit here in my call room, trying to hold a baby in, I wanted to share, some information as far as obstetrics go. And one question that women often have is, when you are pregnant, when do you go to triage? When do you go to the hospital? What symptoms, what things should be going on that makes you concerned enough to want to go to triage? Really, a lot of the things that patients come to triage for are things that just require appropriate education. And so with that being said, things that are important for patients to come to triage for: pain, leakage of fluid, vaginal bleeding. But the number one, I think more than anything, is nausea and vomiting. And nausea and vomiting, or what we call hyperemesis, that's an actual medical definition, and not everybody fits that criteria. It is something that in many cases with appropriate education can actually be handled on an outpatient basis, and patients don't always have to present to triage for that. Usually what happens with patients with hyperemesis is they often allow themselves to become hungry. And what happens when the stomach is empty is that a lot of the acid in the stomach will start to churn. That in and of itself can then create nausea. Once that nausea starts, it's really hard to stop that train once the locomotive starts. I usually tell patients to, number one, try to keep ginger ale around the house and saltine crackers. Ginger is a very good anti-nausea remedy for many women. So that's the reason why ginger ale is often suggested, because ginger helps with nausea significantly for many women. So one thing that some women have done is they will do ginger tea. Ginger tea, some women will chew ginger. Now, I don't know about that. I'm not a fan of that myself, just simply because it's hot. Ginger can be hot. You always want to do small, light things, such as the saltine crackers, bland foods, and try to stay away from anything spicy, greasy, or heavy. If you have medications that your doctor has given you to help with the nausea and vomiting, then it is really important that you get on top of that immediately. It is not something that you wait to see if it's going to get better. You want to start taking the medications that your doctor's given you. When in doubt, if your office is open, you can always call them and get some type of answer as to whether or not triage is necessary, or whether or not you can, they can prescribe you something at home or sort of talk you through it. A lot of this is reassurance. Many women often need reassurance that something is normal. If it's abnormal, how abnormal is it? And is it something that is an emergency? So now, vaginal bleeding. Now, a lot of women do come to triage for vaginal bleeding. And this is something that, I typically will always recommend for women to come to triage for. It is still also something that you can call the office for if the office is open. If it's something like postcoital bleeding, meaning bleeding following intercourse, that is not unusual. Usually during pregnancy, there are a lot of blood vessels that are very robust, and the cervix is very vascular during that time. So some women, may have bleeding following intercourse because of that, because of all of the blood flow that the body creates going down to the, the genitals, the uterus, the cervix, all of that. And so many times that's very self-limited, meaning that it stops on its own. It's usually just a one-time occurrence in terms of it not continuing. Now, some women, very few, will sometimes have bleeding every time they have intercourse. If that's the case, your doctor may recommend not having intercourse throughout the entire pregnancy. And that's just, unfortunately, the luck of the draw, you know, for some women. There are some conditions that we do worry about, though, when women do develop bleeding. One of them is called placenta previa. This is when the placenta implants itself over the cervix. And again, the cervix is what has to dilate in order for the baby to come out. If the placenta is sitting over that, then baby's not going to be able to come out that way. Now, whenever we find a patient with placenta previa, one of the signs is vaginal bleeding. We often will tell those patients to not have sex the entire time. Usually placenta previa, if it is a complete placenta previa, then that is something that will typically warrant a C-section in most cases at 36 weeks, if in fact delivery is not necessary sooner. You know, if in fact you're pregnant and you're bleeding more like a menstrual period, then that is something, you know, that we would suggest you go to labor and delivery for. But again, when in doubt, if the office is open, you can always call first. But if it's something where it's a bit scary and the bleeding is heavy, that is a labor and delivery hospital visit. And, you know, you should go sooner than later rather than staying at home and trying to figure it out. The other thing is another, I think, number 2 complaint, leakage of fluid. And what many women don't understand is that in pregnancy, the cervix will make a lot of discharge. That is a normal thing. Some of this discharge may be watery. It can seem like it's a lot. It can be what women will say looks like snot. And that's possible too. It can be yellow. Sometimes women say it's green. That can sometimes be concerning because then we'll wonder whether there's infection. Many times there isn't. It's just usually having to do with the hydration of the woman when that discharge is produced. And then, of course, you know, there's just, you know, what a lot of women run to triage for and say, I lost my mucus plug. Okay, so it's okay if you do lose your mucus plug later in pregnancy. Usually that sometimes will happen beyond 36 weeks. And so that does not necessarily mean that you're getting ready to go into labor. It doesn't. It just means that your body may be preparing for the process of labor. And essentially, sometimes women will start to dilate a little sooner. And when they do, because your cervix is no longer closed, if this is your cervix, it starts to open and dilate. The mucus that's in there will come out. And that's okay. And it may be a little bit blood tinged with dark blood. It may be, you know, bright red, you know, blood tinged. As long as you're not having a consistent trickle of blood, then of course, I think you should be okay. But of course, when in doubt, call your physician and ask. But if you see just a little bit of, you know, something that looks like mucus come out, that doesn't necessarily mean that labor is going to come right away. Most women who do end up with their water breaking will usually feel a big gush. And if it's a little bit more subtle and not a big one, they will usually complain of stuff just trickling down their leg, them going to the bathroom. They're not peeing, but there's just something coming out. Or they wake up in bed with a puddle. Now, I've also had situations where women say they woke up in bed with a puddle and it's not amniotic fluid. So then what is it? It's probably pee. Now, most women will say, well, I would know if I peed on myself. No, not always. There's a lot going on down there. And not every woman knows if they've peed themselves. And most of the time, when women come in and they either say they felt some fluid or they were in bed and felt wet, it's either quite a bit of discharge or pee. What women can also do is they can put on a maxi pad and walk around for an hour or so and see if in fact they fill that pad with fluid. If they do, then that means that there could be an issue. You could be, your bag of water could have broken. But if it's not, and it's just a little itsy bitsy amount, it's probably vaginal discharge. But again, if the office is open, call your doctor. If in fact you have a labor and delivery that allows you to call with questions, call them. They are happy to help triage. Oftentimes, so that you don't make an unnecessary visit at 1 o'clock in the morning when you really need as much sleep as you can get. There's also the pain piece, okay? And so with pain, it can come from several things, right? A lot of pain comes from, number one, just the body and the ligaments stretching. The pelvis is trying to prepare for a baby. It's, a lot of it seems like your bones are just creaking and aching, and, there's so much pressure and all of that kind of stuff. The most common complaint that women have in terms of pain is round ligament pain, okay? So what is the round ligament? The round ligament is a small little ligament that is usually about this short when you're not pregnant. Okay, it is a ligament that goes from the top of the uterus all the way to your pelvic bone. So if you were to stand up and feel your pelvic bone right here, your uterus is usually about that tall. And if your uterus is like a pear, if you turn the pear upside down, those ligaments go from the top of the pear all the way down to the pubic bone. Okay, when your belly gets as big as mine, okay, those ligaments are now all the way up here. They stretch. The woman's body is very amazing. Now, the only problem with those ligaments stretching is they can cause significant pain when they spasm. Usually when women experience that pain, they're going to experience it within this distribution. So usually when they come in and they complain of pain, I'll press either here or down here, and that's usually going to elicit that pain, and that's when I know that we're dealing with round ligament pain. It is painful, but it's not dangerous. It is a normal process of pregnancy. What I do tell patients to do is a lot of times that ligament will spasm when there's quick or sudden movements. Many women are going to experience this when they're turning over in bed or when they're doing the motion of getting out of the car and doing one leg at a time. So what I often will tell women to do is try to pick up both legs and then put both those legs out of the car so that your body is shifting along with your uterus and you're not leaving your uterus behind when you're putting one leg over here and your uterus is still here, but that leg is here. So it's, so that it doesn't stretch that ligament. There's also belly braces that you can get online with Amazon. They come in all different sizes, styles, colors. When I was coming up with my first couple of pregnancies, they were just white. And you just, that's it. And it just basically goes around the back. It's Velcro, and you just kind of hook it around and it goes around the belly. And that just kind of keeps your belly stationary so that it moves with you and it's not kind of independent, so those ligaments won't stretch, suddenly causing that pain. Now, the other thing that pain can be is contractions. Do contractions start to happen, before a woman is ready to deliver? Yes. These are called Braxton Hicks. Oftentimes, these are very benign, meaning that there's not they're not causing any trouble. It's just what I tell women, their body's way of practicing before the real thing. And sometimes Braxton Hicks can also, though, be brought on by dehydration and inappropriate nutrition. So, and also patients needing to pee. One thing that women will notice is that when their bladder gets full, they'll start to have more contractions. We tell you to drink more water, but that means that your bladder is going to get full, which then means you're going to contract more. It's an oxymoron, but you have to stay hydrated, but just empty your bladder in, often. So whenever you notice that you are having some contractions, most often the best thing to do to see if these contractions are going to go away is, number one, trying to rest. Okay, if you can do that, trying to make sure that you stay hydrated. And I tell women, as far as hydration, whatever your weight is in pounds, you should be drinking half of that in ounces of water. Meaning, if you are 160 pounds, you should be drinking minimum 80 ounces of water a day. That is minimum. So making sure you're hydrated, making sure you've eaten enough throughout the day, your caloric intake has been adequate, because that is another thing that will make a woman contract. So trying to do those things: eating, drinking, resting, seeing if those contractions go away. If they don't, they increase in frequency, meaning that you're getting them more often. They're becoming closer together in terms of time. They're becoming more intense. Then you probably should give your doctor a call. Other things that are just a bit crazy that people come into triage for is, I think it's just, they like the turkey sandwiches or something. That's what the nurses tell me. They tell me that they think the patients like the turkey sandwiches. I don't care for the turkey sandwiches personally, and I try to stay from the hospital at all costs. I don't want to be here even when I deliver. So I try to stay away from anything that's going to put me in a position to be in a hospital bed, because they're not comfortable. And, you're just sitting here in a gown with your back out, and you're uncomfortable. And, a lot of times I tell women, you could be in your own bed. So a lot of this is simply just using judgment, education, and trying to sort of navigate things. A really good book that I thought was very helpful for me throughout my pregnancy was What to Expect When You're Expecting. Everything is nearly in that book. They've updated that book 1,000,000 times. And I honestly, have women go to that book all the time, because there are a lot of questions that can be answered. There's a lot of remedies that can, put a patient in a position to have that education to know what to do and what not to do if in fact they were to run into issues. So I always recommend getting that book, because knowledge is power. And reading, is important, especially when you're getting ready to bring forth new life. Whether or not you're a first-time mom, second-time mom, or 8th-time mom, there's always something new to be learned. Of course, I always encourage women to have an open dialogue with your doctor. No question is ever a stupid question if you do not know the answer. Please always understand that we are never here to judge. We're here to educate, and we're here to help. And we want your pregnancy to be one that you enjoy, one that is not fraught with a whole lot of complications, problems, back and forth to the doctor, back and forth to triage, labor and delivery. We want this to be an enjoyable time for you, one where you can bond with your pregnancy and your baby, and not necessarily feel like it was a time where you couldn't do that or you didn't get that luxury. It is a luxury to really be a mom, and it's a luxury to be pregnant. There are so many women out there that have not had such a luxury and wish that they could. And I love for women to embrace it when they are able to. So again, these are just a few things that I wanted to touch on when it comes to labor and delivery, triage, what to come in for. So thank you all for listening. And I will probably come back to you again as my belly gets larger and my baby gets bigger. And then we'll share some more tidbits of information that I hope will help all of you one of these days out there, or at least help a friend. You guys take care.